in this study, we leveraged participants in the Multiple Sclerosis Partners Advancing Technology and Health Solutions Network, which is a large, real-world, well-characterized prospective cohort from 10 MS centers in the United States and Europe. And we aim to assess the association of neurofilament light chain with longitudinal brain atrophy and neurofilament lesion development. Now, in MS, there is evidence already that serum neurofilament light chain levels are associated with measures of inflammatory disease activity and are predictive of brain as well as spinal cord atrophy. However, existing data are mainly derived from single center studies or post hoc analyses of clinical trial cohorts that are largely homogeneous. And so we sought to evaluate this in a larger population that is more diverse and heterogeneous in the MS PASS cohort in a large real world cohort. We looked at neurofilament light chain and its ability both, so participants had measurements performed at a single time point. And that time point was linked to an index MRI. And then what we did was we looked back. So we looked retrospectively to see compared to a prior available MRI, the change in brain volume, as well as prospectively. So looking at subsequent MRIs, what was the association between the NFL at the time of that index MRI and future brain atrophy and new T2 lesion development. And we were able to include in this analysis approximately 3,700 participants were eligible for inclusion in either the retrospective or prospective analysis, of whom about 17% had elevated NFL. And what we found was that NFL was associated with a faster rate of brain atrophy, both in the period preceding the measurement of NFL, as well as this period after that, with an approximately twofold difference in the rate of brain atrophy between those who were classified as having elevated NFL based on measurements in a healthy control cohort that we had versus normal levels of NFL. And this was about the same in both the prospective and retrospective analysis, about a twofold difference in the rates of brain atrophy. These findings were fairly consistent across key demographic subgroups and across MS subtypes, so looking across relapsed remitting versus progressive MS. And then we also assessed similarly the association between new T2 lesions, again, either in the preceding period or the following period after the measurement of NFL, and saw that elevated NFL above the cutoff that we defined using our health controls was associated with about a 2.7-fold increase in the odds of a new T2 lesion in the preceding period, and an almost twofold increase in the risk of a new T2 lesion, in the odds of a new T2 lesion in the following period after the NFL measurement. Also with similar findings across that key demographic and clinical subgroups. This study supports that, first of all, our study included a single baseline measurement. And so this supports that a single measurement can be associated with short-term retrospective and prospective brain atrophy and new T2 lesion development. Now, this was a relatively short follow-up duration, with the median retrospective follow-up being 1 year and the median prospective follow-up being 1.7 years. Importantly, these associations were overall consistent across disease subtypes and demographic groups. And it supports the rationale for further studies to evaluate the use of NFL potentially in clinical practice. And I do think that it will be important to assess the utility of serial monitoring rather than a single time point, since it is likely that will allow us to get a better overall picture of the disease course. And this is an analysis that we are pursuing in the MS PASS network. So looking at serial NFL measurement and associations with both longer term radiological outcomes as well as with clinical outcomes.